This is PublicDefib.TV. I'm your host, Lawrence Sabin, and it's time for episode 2 of our online series where we share with you exactly how to save a life with an AED. And if you're following along here, maybe you're watching on a laptop or on a mobile device and you've seen a video here, you might still be curious. Is this guy saying that I could save a life with a medical device? Is that what I'm really getting at? Yes, indeed. That is our point here. Granted, we have many first responders that are equipped with these life-saving devices. Fire and EMS and law enforcement officers, and certainly in medical settings too. But these AEDs are hanging in public places for a reason, and that is they are specifically designed for really not just that first responder, but for anybody to use to save a life. And this happens. We have rescues all the time, and being that I'm in this line of work, I hear so many of these rescues that happened at a city building where somebody dropped, or at a church service, or even in a school setting at an athletic meet, or a competition of some kind where somebody drops, and an ordinary person comes along, uses an AED to revive that life, really literally bring them back to life. And that's what we're here to illustrate. So here in episode 2, what we actually want to show you before describing these in great detail is exactly how they work. So what we're going to do is a demonstration. So you're actually going to see this device work. And to do that, we need a person or a mannequin. So we're going to use our mannequin friend here. And we're going to lay him down, and we're going to assume that this guy has dropped suddenly. He's not breathing. He's showing little to no signs of life, and that we've checked for responsiveness, that we have instructed somebody to go get the AED, the automated external defibrillator, and that we've instructed somebody to call 911. And for purposes of our demonstration, we're going to be using this Philips HeartStart AED, and this is a particularly popular AED. And of course, as you watch the many episodes that we'll do, we're going to be covering all different brands, all different types, and we're going to be distinguishing just exactly how different they are and how they all work. But for this, we're going to use this Philips HeartStart AED, which is recognized by the red and white carry case, and we're going to perform a rescue with this. So again, our patient is down. For purposes of the demonstration, I'm not going to say a whole lot. I'm just going to let the AED instruct us and show us exactly how to save a life, and I'm just going to follow along as directed. So with that said, let's open our carry case, flip open the lid, and let the AED do its thing.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
We'll turn the device off and cease the demonstration. Thoughts, observations, easy to use, right? We simply followed the prompts, placed the pads, it analyzed the rhythm, determined that a shock was indeed needed, and we delivered a shock and then began CPR. And what we do here is we do 2 minutes of CPR, at which time we'd be instructed that the AED was going to analyze again and determine if a shock was needed or not. And so breathing a little heavy here because CPR compressions can wear you out a little bit, but that just really illustrates how simple to use the AED is. Now do you believe that you could actually use a device to save a life? Certainly. So now that we've shown that, and we'll certainly be sharing many more things about AEDs, you do have some homework tonight. Now that you've seen one of these AEDs in action, now it's time to look for them. And so what I would ask that you all do is look when you go to the store tonight, when you go to the pharmacy, is there an AED hanging on the wall? If you go to the gym, did you walk right by an AED? Maybe you could ask the question, are we equipped with an AED here at our gym, or at church, or at the workplace, or really wherever you go? I want you to be observant and look for these devices. It's kind of like if you're car shopping. We have the power of perception, right? If you're shopping for a Jeep Cherokee and you're looking for that car, suddenly what happens on the road as you're driving around, you're going to see these cars everywhere. There's a blue one, there's a white one, there's a red one. Were these Jeeps not there a few weeks ago? Sure, they were there all along, but now we've opened up our perception. So that's exactly what I want you to do with these with AEDs. Is I want you to be on the lookout, and I want you to ask the question at work: do we have AEDs? Have we thought about getting AEDs? And that's your homework assignment. So thank you for watching this short video and the demonstration of the Philips HeartStart AED. And we thank you again, and do ask that you subscribe to our channel. Thanks so much.